Welcome everyone. Thank you for joining us today. I'm Teresa Marentet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Today we are reporting an increase of 41 new cases of COVID-19 in Windsor and Essex County. 20 are close contacts of confirmed cases, 4 are community acquired, 1 is outbreak related, and 16 cases are still being investigated. We have had 15,568 cases since the beginning of the pandemic. 427 people are active at this time, with 114 active cases having the variant. 934 preliminary or confirmed variants of concern have been identified in Windsor-Essex County, with 90% of these cases having the UK variant, 2 cases having the South African variant, and 3 the Brazilian variant. 20 people from Windsor-Essex County are currently in the hospital, and 3 people are in ICU. Our community has lost 414 people to COVID. There are currently 13 active outbreaks in Windsor and Essex County, 9 workplace outbreaks, 1 long-term care home, 1 school, and 2 community outbreaks. Now for our vaccine update. 168,667 doses of a COVID vaccine have been administered to Windsor-Essex County residents. 154,788 people have received at least 1 dose. Today we are excited to be opening up the 2 pop-up vaccination clinics, one at St. Angela Church Hall at 750 Erie Street East for those living in postal code area N9A, and the other one is at Mackenzie Hall, 3277 Sandwich Street West for those living in the N9C postal code area. The clinics are now open, and despite lineups, we are moving along. We are giving out appointment cards and are now at 1 p.m. for St. Angela. We have also increased our vaccine supply at Mackenzie Hall due to the great response in that area. In addition, we would like to announce that those 18 years of age and older living in a hotspot postal code are now able to book at 3 of our vaccination sites. Windsor Hall, the Moy Clinic, and Nature Fresh all are situated in hotspot postal code areas, and people will be able to book. The postal codes that are in the hotspot areas are N8X, N8Y, N9A, N9B, N9C, N8H, and N9Y. Transportation is available free of charge if needed. Please call Bet's Cab in Windsor or Sun Parlor in Leamington. Residents who require wheelchair accessibility taxi service can contact Checker Cab. And Transit Windsor continues to offer free rides for anyone going to and from a vaccination immunization site. Today, we are also dropping our age limit across all vaccination sites to those 50 years of age and older. This is for the general public outside of those living in hotspots. So please visit wevax.ca or call 226-773-2200 to book your appointment. One final note is that those in the first group of frontline essential workers who cannot work from home will be able to book their vaccine appointment beginning Thursday, May 6th. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning, and thank you for joining us again today. This week we are getting the largest supply of vaccine to date in our region. As a result, you have noticed that we are opening it up for additional priority groups in addition to dropping the age band further. Our health unit staff, our hospital partners, and our municipal partners are working tirelessly to ensure that we continue to vaccinate our residents as quickly as possible. With the additional doses of vaccine coming to our region, our goal is to offer vaccine to everyone in our region to prevent COVID-19 transmission and save lives. If you are not included in the current priority, please note that we will get to your priority as soon as possible, and it is absolutely necessary that you wait for your turn to receive the vaccine. For those of you who have received the vaccine, please note that public health guidelines still applies to you, whether you just received the vaccine or received more than 2 weeks ago. Getting a vaccine does not mean that you can lose your guard and be complacent in following public health measures. Unless we reach a certain threshold of vaccinated people in our region or the public health guidelines is updated to reflect the ongoing risk in the community, it is absolutely critical that we all follow the public health measures. We still have a significant number of active cases in the region, and with more than half of cases being the variants of concerns, things can change quickly. We know that vaccines are not fully effective against some of these variants, and we must not let the variant spread in our community further. I want to thank you for doing your part in following the public health measures and keep our community safe. Thank you.
We'll now take questions from the media. Today we'll start with the Windsor Star.
Good morning, Doctor. Good morning, Teresa. Do you know how many more doses you've allotted to the Mackenzie Hall pop-up?
So we had estimated about 300 vaccines that would be assigned to Mackenzie Hall based on the timing and the, our ability to vaccinate. And so I think we're going to provide that site with about 150 more doses and maybe a little bit more, and that'll probably be the maximum for that site.
And do you have a sense of at what rate you're able to vaccinate people at both sites?
It will depend on the, it's on the flow of the, of the individual. So I know at St. Angela, we have 7 stations right now with the ability to vaccinate 14 people at a time. And so it depends how quickly that happens, how quickly everyone can get vaccinated, but they have to wait for 15 minutes after vaccination. So it's not only the vaccination time that takes a little bit of time, it's the recovery period. And there's only so much space, and it's allowing the maximum of, amount of people in that space to be safely distanced while they're recovering. So that may be where some holdup will be as well. So before we release people, and we have to make sure it's timed very well. So I don't know specifically how long all that is taking, but we'll keep moving as quickly as we can. I was told that at St. Angela, a lot of the group that's being vaccinated right now are in their 20s, so they're probably able to get in and get vaccinated and then wait their recovery period and move on. So we'll have more information as the day unfolds.
I'm outside Mackenzie Hall right now. I'd estimate there are probably at least 200 people in line, and the line has been moving. So will you at some point have somebody at the end of the line turn people away?
So we do have people monitoring the lines right now, and at St. Angela, they're giving out like little appointment cards to tell people to, when their appointment would be or when their timing would be based on the flow. And so Mackenzie Hall, people will be monitoring that line as well and make sure that people are not, in line if there's not an available vaccine dose for them. So that is being monitored right now as well.
Thank you.
Any questions from AM 800?
Lisa, with the pop-up clinics, was there some confusion this morning? We heard from a couple business owners that have businesses in one of the postal codes that they went to a site that they weren't supposed to go to. Was that, delivered properly to business owners that are looking for the vaccine to make sure they go to the proper vaccination pop-up site?
I'm not familiar with the situation you're referring to, so I don't know about business owners. We released information to some of our community partners over the weekend to reach out to people living in the postal code areas, and then with our media release this morning, that's the only information we've given out, and it's really been very specific to St. Angela or Mackenzie Hall. And as you know, prior to this, we had contemplated an outside pop-up clinic, but because of the weather, we changed those plans. So I'm not sure what other, where the confusion was with that certain business.
So at the end of the day, if you're in one of the postal codes, the N9C and N9A, if you're in N9A, for example, you're supposed to go to the, I believe that's Mackenzie Hall, and N9C is for Erie Street, St. Angela.
Or is that, that is correct, okay. I'm just wanting to make sure I don't have my postal codes mixed up.
Okay, just looking for clarification there. And then today, obviously, like you mentioned, 50 and older. What kind of demand, what kind of response are you anticipating? Do you have a number on that age bracket, I guess from 50 to 54?
So I'm gonna see if Wajid can, Dr. Ahmed can look that up, but
So 50 to 54, we have a total of 31,000 people that are eligible. And we already know that at least 30% of them, I believe, let me just double check. Yeah, so we have 37% of them already vaccinated between the ages of 50 and 55. So we have still a large number of population that can benefit from booking the appointment and getting the vaccine. And as soon as we get to a comfort zone where we feel that we have vaccinated or we have provided a good coverage to that age group, we'll continue to drop the age band further to ensure that we utilize the vaccine as quickly as possible to the eligible population.
Thank you.
Any questions from CTV?
Hi, yes, good morning. So were you guys pleased to see that there was a line this morning at both locations?
It's a pretty exciting day to be offering this to people living in an area that otherwise wouldn't be able to access the vaccine based on the age or even the ability to book. So I don't know if we're excited about lineups. We were told that people had, once they heard about it, that people had been waiting for quite some time. So that's unfortunate because in the end, we hope throughout this vaccine rollout that anyone who wants a vaccine will be able to get it. But as far as the response today and the ability to bring the vaccine to people in neighborhoods that really want to be able to attend a vaccine site and to have the ability at 18 years of age and older, that's pretty exciting, but not excited about lineups, but recognizing that's the model we have, and hopefully people are having, not too bad of an experience today.
Absolutely. And how many extra doses do the hotspot locations get?
So according to the ministry, they'll be getting about 50% of our supply, so around 11,000 doses per week.
And were you surprised by the province expanding eligibility? And are there enough doses to meet that demand?
I can start. I don't think we were surprised. We do acknowledge that moving down in the age bands would be beneficial for our area as we get more and more people vaccinated. Moving to 18 plus in the hotspot areas, we were probably not as aware of the province moving so quickly with those areas, but we recognize that provincially, those in hotspots are having real issues, and we are happy to move along. And we did, ramp up very quickly on the weekend to get the website updated, our booking system updated, and the media release out to inform people. So those that are attending the pop-up clinics today, it is really reassuring to know that they will have that ability to book online and get vaccinated at one of the clinics that are actually in their, in a hotspot area. So in Leamington, as of Thursday, we'll have more appointments opened, because right now we're finishing up the farm workers, and that will go right until Wednesday. And we also have the Moy Clinic in downtown Windsor, or in Windsor, and the Windsor Hall Clinic by Windsor Regional Hospital. So these sites are right in hotspot areas. So we're very fortunate, and we'll hopefully be able to continue immunizing those that haven't been immunized yet.
Great. And speaking of the website, we did hear reports that there were some issues with the booking recently. Has that all been settled, or was that just people trying to get on caused a crash? Or?
Well, I'm looking at our communications person, and he's nodding that everything is going well right now, but I understand there was a crash earlier today, and but everything is up and running right now.
Great, thank you.
Any questions from CBC?
Hi, good morning. I was going to ask about the expansion of the rollout of appointments to 18 plus individuals in those hotspots. And I also noticed that the site crashed this morning. Does that mean that there are there any appointments left at this point? I'm wondering if you can speak to the response, or if you have any information.
Well, we do know that there are appointments available right now, and as you know, we continue to monitor the appointments and open up days as things get filled up. So we will continue to do that and look at that and make sure that any availability for an appointment is reflected in our booking system online or by calling the phone number, which, as you know, the call center, they see the same appointments that are online. So it's basically the same. What you see online is what the call center sees as well.
Yeah, and I can just say that,
sorry.
yeah, just to add to what Teresa said, we have appointments available as of Thursday and Friday as well. So it obviously it is filling up quickly, but we do have an appointment this week.
Thank you. I also wanted to ask about something that came up a little while ago. There was talk of Pfizer potentially coming to pharmacies. Are there plans in the works for that? And if so, would those vaccines come from the health unit supply or directly through the province, as we saw with AstraZeneca?
So we were part of the AstraZeneca pilot site, and then, as you know, AstraZeneca went out to the pharmacies in our area, and there are some health units that are participating in a Pfizer pilot site. We are not one of those health units, and but we're always happy to participate in any pilot site or pilot study that the province is doing. So if there's something further, we will make sure we volunteer. But right now the Pfizer was for specific areas, and Windsor is not one of them.
Thanks very much.
Any questions from Radio Canada?
Yes, good morning. We were told that a vaccination center could be organized at the border for Windsor residents with unused doses from Detroit and Michigan. I think it's actually an idea of Mayor Drew Dilkins. So have you heard of that, and what do you think about it?
At this point, I can say that there was some talk that was happening, and there were many partners involved in those discussions, and I haven't had anything confirmed at this time.
Okay, but do you think that could be possible? That's something that we can do?
Well, there are a number of logistical challenges that we have to understand, that if we are organizing a clinic where you're getting the vaccine, how the vaccines are coming into Canada, whether we need an import license, and under what authority we are bringing in these vaccines. So there are a number of logistical challenges that needs to happen before that can possibly take place. These conversations are happening at the provincial level as well as the federal level to make sure that all of these things are in place, and how we can benefit from our neighbors that may have extra vaccine that we can use. So a lot of these discussion and conversations are ongoing, and it will take some time before all the logistics are sorted out.
Okay, thank you. And my second question is, I think we used to transfer some people to Detroit in some very rare cases. Do you know if we are still doing that? Like if we're still transferring patients to Detroit when there is need to do it?
I can't answer that question. I think that question should go to the hospital. All I can say that I haven't heard any potential transfer at this time, but the hospitals will be in a better position to say that.
Okay, thank you.
Any questions from Blackburn?
Nothing keeping open asked and answered, thank you.
Okay, any additional questions from the Windsor Star?
Yes, based on how planning has gone today, and I understand the day is not over yet, but do you anticipate doing other pop-up clinics in other hotspots or maybe in the same hotspots again?
Well, we'll see how today goes. We were in a unique position today because there's a little bit of a, not a break, but today was a day that we had our staff available to do the pop-ups. So we have overstaffed both of those pop-up clinics, and the staff that are working the pop-up clinics today are the same staff that are staffing the vaccine clinics, the mass vaccine clinics. So today was a day in the schedule that allowed us to do this. That's why even though we knew the weather wasn't ideal, the day we couldn't renegotiate the day because of all of the available resources from our health unit to make this happen. But I would say never. I think as we get more data on the coverage rates, and as you know, our EPI is on top of that, looking at specific hotspots and the ability to make sure that we're bringing the vaccine to people if they're not able to go to where the vaccine's available. So I think we'll continue to look at that and, possibly explore more opportunities.
Thank you.
Any additional questions from AM 800?
So just to clarify again, I know you mentioned in your first comment to Taylor's question in regards to the doses. So about 450, maybe a little bit more, like you mentioned, at Mackenzie Hall. And is it about 300 at St. Angela?
Oh, no, St. Angela will be much more. St. Angela, we were counting on probably closer to 700 doses vaccine at that site. We have, or possibly more, but I don't know the exact numbers for St. Angela, but they have the ability to do more at St. Angela than they do at Mackenzie Hall.
So basically at the end of the day, it looks like almost maybe 1,100 plus people in Windsor, in those postcodes, will be administered the vaccine.
I'd say that's a good estimate, and we'll know more tomorrow. As you know, we're putting it right in the COVAX system, which is the ministry's live data site that all doses get entered. So we'll be able to have up-to-date information by the end of the clinic and see exactly who we reached and break it down by age group and have a look at the who attended. So that'll be really valuable information.
Okay, perfect. And one final question for Dr. Ahmed. Dr. Ahmed, not sure if you want to comment on this, but church in our area, once again, not following the restrictions in place. Do you want to make any comments on just your thoughts?
Well, it is disheartening, Rob, and we have been to this position earlier as well, and we all know that this is still a pandemic. People are dying in other parts of the world. We have seen how quickly things escalated in our region in December and January. We definitely don't want that to happen. And while I understand that people's sentiments, whether they want to meet up or have social gathering or even religious gathering, these are not the same time, and there are ways that you have to keep yourself safe and you have to keep everyone safe as well. There's a stay-at-home order in place. There's a restriction on any type of gathering. So all of those things are in place. I would just request everyone to please follow those measures. Those are measures that would save life, that would keep everyone safe. So I would request them, I would beg them, please follow the measures. It is important for our community.
Thank you.
Any additional questions from CTV?
Yes. So I know that eligibility has been expanded to those 18 and older in all hotspot areas right now, but I was just wondering why start with the two areas that we did the pop-up clinic at today?
When we looked at our data, these two postal codes were one of there's about three, but these two had the lowest coverage based on our stats. And it was just, trying to move very quickly. It wasn't that we had these planned for weeks and weeks. It was a very short turnaround. And we were looking at the availability that of the actual site locations to provide a couple pop-up clinics. We also last week worked with the Windsor-Essex Community Health Center, and they were able to provide two pop-up clinics at the street health site. And so that would have been our first kind of pop-up clinic. And so we were just trying to provide coverage. So they were just the initial ones based on, the logistics of having it all work in a very short turnaround time.
Thank you.
Any additional questions from CBC?
No, thank you.
Any additional questions from Radio Canada?
No, thank you.
Any additional questions from Blackburn?
No, thank you.
Thank you, everyone. Have a great day.